and salt trucks are out today. So just go slow. There have been a lot of wrecks, a lot of accidents. I've listening to the radio, and so, you know, just go slow. Today we are going to talk about COVID, the numbers, we're going to talk about vaccinations, and we're going to take your questions. So beginning with the numbers, yesterday the city of St. Louis had 71 new cases of COVID reported. Day before it was 60, the day before that it was 97. So our average, 7-day average of new cases in the city of St. Louis is at 86 right now, and that's about 29 per 100,000 people per day. Still too high, but good numbers compared to the rest of the region. Number of hospitalizations, there are today, these numbers are 2 days old, by the way, 644 people that are hospitalized in the region, either COVID positive or suspected positive. So 596 positive and another 48 suspected positive to give you the 644. Of those 644 people, 135 are in the ICU and 90 are on ventilators. So still a lot of very ill people. But of course, those numbers are certainly better than they were a month ago or 2 months ago. Patients admitted to the hospital yesterday was 61. 2 days ago was 61. The 7-day average per day for people admitted to the hospital is 75. I'm going to remind you what the goals are here. The goal is in the city of St. Louis, 35 new cases a day. We are at 86 right now. The hospital admissions, the goal is 40 per day. We're at 75. The number of people in the hospital, the goal is 350. And we are at 644 today. And then the positivity rate, the goal is 5%. I'm not sure I have today's positivity rate. Yesterday it was 9.4, 9.5%. So we're under 10%, that's good, but we want to be half of that. So we still have a ways to go. We know that everybody still needs to be wearing their masks, socially distancing, keeping their groups small, washing your hands, so that we can keep these numbers going down. We also know that the vaccine is here, but not nearly enough of it. I am happy to report that yesterday the city received its first shipment of vaccines. It was 3,900 doses. We will be vaccinating police, firefighters, corrections, EMS, all of our first responders first. We've already vaccinated about 750 of our first responders, but we have quite a number left to go. So we will be vaccinating them first. Those vaccinations will take place at the end of this week. Also, as you undoubtedly know, healthcare workers can be vaccinated, so we will be vaccinating our health department. We'll be vaccinating people that are working with our human services department and with folks in our homeless shelters. Anyone who wants it. This is, of course, a voluntary vaccination, but they'll be offered the opportunity to do that. The next tier of people that are eligible to be vaccinated are people 65 and over, and people with a specific list of underlying health conditions as defined by the state. And so we will also begin to vaccinate city employees that fall into those categories. So we're happy about that. We all need more vaccine. We are optimistic that local health departments, hospitals will begin getting bigger shipments of vaccine. I think yesterday the Biden administration announced that in a couple of weeks it should go up by 16%. That may not sound like a lot, but any increase is a good increase so that we can get more folks vaccinated. So I think that's all I have to say for today. We were a little late today. Sorry about that. I hope we didn't lose too many viewers, but a little technical difficulty and some other stuff going on.
Questions?
Uh-huh.
Okay, lots of questions, mainly vaccine related. First, Denise's question, Mayor, is how does the general public know about where vaccines are being administered, and how do folks sign up to get one?
So you can sign up on the city's website to get a notification about any mass vaccinations. We don't have mass vaccinations right now, but we do know that, and I should have mentioned this earlier, the VA, if you're a veteran, you can sign up through the VA. They have their own supply. We also are trying to discern if we're going to get 3,900 doses next week and the week after, or if this is going to be a one-off thing. We know we have to have, in 3 weeks when we use these, we know we have to have the second shot, second vaccination ready to go. So you can sign up to get notifications. Of course, we will put it on social media. It'll be on the news. I don't believe you'll miss it. Let me say one other thing about that. And I know this is a question a lot of people have. For people that are not 65 and who do not have an underlying health condition, it's going to be a while. And I know that's not the answer that you want, but we know that in the state of Missouri, there are over 2 million people who fall into the categories that are already eligible. Now there's 6 million people, 6.2 million people in the state of Missouri. So for those of you that are younger and in good health, that's a blessing, but it will be a little while before you're eligible to get the vaccine.
Lois's question is, does the city have sites selected for when vaccine becomes more readily available for places like a mass vaccination event?
We have several options, but we do not have dates or specific places or times yet for that. When you think about the logistics of giving a vaccine, there's a bunch of stuff you need. 1, you need the vaccine. 2, you need the syringes. You need the swabs, you need the cotton, you need the gloves, but you need the syringes. 3, you need the place, and most importantly, you need the vaccinators. So all of those things are coming together, and when we're pretty certain that we can have a supply and the second dose, we will be working most likely with our partners, the federally qualified health centers, perhaps some pharmacies, and the National Guard, which the National Guard is going to be doing some vaccination sites. Most of them are not, I don't know of any right now that are in the city of St. Louis, but those are all things that we're working on.
The city received its first shipment after many other jurisdictions in the state. Was there any rhyme or reason for why ours just arrived this week?
Well, it wasn't after many. It was about a week or so later, but there are still many counties, including, is it Jefferson? Including Jefferson County that don't have any. So, we placed another order yesterday, because the order has to go in has to be in by Tuesday. I think we placed it on Monday, and we are going to continue to try to get vaccine. But there's 114 counties in Missouri, and so.
Lisa's question is, if you live in the city, do you have to be vaccinated in the city of St. Louis?
No, you don't, Lisa. You can, if you can get an appointment somewhere else, and anecdotally through Facebook, social media, and just, friends, I know many people who, not many, I know some people who have been able to get the vaccine through BJC or through Mercy or St. Luke's. Or there are even people that drove to Washington, Missouri because there was a place there they could get it, So people can go outside of where they live to get the vaccination.
When does the city anticipate being able to administer doses to members of the general public who fall into the phase 1B, tier 1, tier 2 categories?
Hopefully within the next few weeks, if we get the vaccine.
We have two questions about some of the announcements from the Biden administration this week. One, what are your thoughts on his vaccine rollout plan? Are you encouraged to see those sort of numbers, and will it impact the availability of vaccine for the city?
You know, I'm very encouraged to see those numbers. I know that the Biden administration, at first they said they wanted to vaccinate 1 million people a day, and I think recently they said 1.5 million people a day. You know, the state of Missouri, if you think through this, has 2% of the population in the U.S. We've got 6.2 million people. There's about, I think, 310 million people in the whole U.S., so we've got about 2% of the population. So if there's 1 million doses a day going out, I hope Missouri gets 200,000 of them. That'd be 2%. Now, they don't all come to cities or counties. Some of them are going to federal agencies. Some of them are going to pharmacy. You know, they're going to different places, but we ought to be getting 2% of whatever's being distributed, just based on population.
Rachel's question has to do with folks under the age of 18, kids. Where do they fall, and when do you think kids will be able to be vaccinated?
Rachel, I'm not even certain that this vaccination is approved for kids, little kids. So I don't know the actual answer to that. We can look that up and post it, but that's a ways off.
What phase? Jennifer's question has to do with the phases. Missouri claims to be in phase 1B, tier 2. St. Louis City hasn't been able to vaccinate members of the public in that phase yet. So what phase is the city in?
Well, we are allowed to give vaccinations to anybody who's from phase 1A to phase 1B, tier 2. So that's why we are beginning with our first responders and healthcare workers in our first phase. Then when those are done, which we expect that they will be done pretty quickly, we've already done 750 and we'll do, more. Then we move into phase 1B, tier 2, which are those people 65 and older, or people 18 to 64 who have one of the underlying health conditions.
Lisa's question has to do with vaccines continuing in Missouri. Do you still support a statewide mask mandate? And could you also please remind people that they still have to continue social distancing?
Lisa, thank you. Yes, reminding everyone, you've got to continue to wear your mask. We still have a mask mandate in place in the city of St. Louis and in St. Louis County. I don't expect that's going to go away. The exception to it is if you have a health conditions that prevent you from wearing a mask, or if you are sitting at a table eating or drinking. So we still have to have the mask. Of course, I would support a statewide mask mandate. That's not going to happen. It hasn't happened yet, so I don't see that happening. I suppose it could. We're all concerned about these new variants on COVID because it's said that those are even more contagious. And so it's even more important that you wear them. Well, I don't know if it's more important, but it's extremely important that you do continue to wear a mask. And some folks are even suggesting, that you make sure that you get a tri-ply, 3-ply mask, because if those variants are more contagious, then they're more easily spread. We don't have any confirmation that those variants are here in the state of Missouri yet, but there's no reason to believe that they aren't, or that they're not close by. So.
A few more questions. D. Marquise asks about continued refusals of folks who will not take the vaccine. Will that continue to be their right, or will there get to a point where we have to make it mandatory?
I imagine that taking the vaccine is going to continue to be voluntary. So I don't see a day that changes. Now, I would encourage everyone to get the vaccine, get the vaccination, because this is very contagious, and people do get extremely ill, and some people do die from it. So the vaccine has been proven to be very effective, and it's proven to be very safe. So I encourage everyone to get the vaccine, but it is voluntary.
Of the city's first shipment of 3,900, does that include first or second doses, or both?
First doses,
So the second dose comes later?
3 weeks.
Okay. Ned has a question related to COVID and rent relief and the additional assistance. Yesterday, the Missouri House mentioned Tuesday. Yesterday, they'll have applications ready. Do you know when the city will have additional assistance available to the public?
We do have additional assistance available. We received $9 million not quite a week ago, give or take, and we are continuing to help people with rental assistance. We still have people that we're working through that applied, last month, and it's a bit of an onerous process. This is federal money. You got to have your paperwork in shape. And so we're continuing, our partners, and we have about a dozen partners, are continuing to work with people to approve the rental assistance, and then that rent is paid directly to the landlord. But we do have more funds coming on that. It's going through the Board of Aldermen right now. They'll probably pass it this Friday or maybe next, soon.
Patricia's question has to do with the eviction moratorium and COVID. The city's, I believe, expires toward the end of this month. The Biden administration's goes through March. Will we be adopting the federal one, or do you know if we'll be enacting a new local one?
So that's something that we are currently working with the judges on. That's not a decision that gets to be made by the mayor's office, so we're working with the judges on extending that.
That's all for questions I have today, Mayor.
It's all for questions. Maybe some people would want to know this. Yesterday, I did veto a board bill which would have called for an issue to be placed on the ballot a second time about reducing the size of the Board of Aldermen. So in 2012, so 9 years ago, the voters of over 80,000 voters, 80,301 voters, voted to reduce the size of the Board of Aldermen from 28 to 14. That would happen in 2023, which isn't far off. And so I vetoed the bill that would have that sought to undo that. So just to let everybody know, some people do know that. Other people have asked me previously, so just a little add-on here to our COVID conversation. And if that's all the questions,
That's it.
thank you guys for being with us. Appreciate you. Bye.